this segmental joint range of motion test, we are going to be looking at hip extension. So I have my client here in the supine position. I'm going to ask that he hugs the right knee to his chest, and before I have him get into position, I am going to be putting my axis right at the greater trochanter, my stabilization arm down the midline of his body, and then my movement arm is going to go down the midline of his femur. The first thing that I need to do to get him into correct position is to palpate his ASIS. As I get him into the point of first resistance, I also want to make sure that his low back doesn't begin to arch. Okay, go ahead and hold that position right there. I will get in position here, down the midline of the femur. Okay, and go ahead and relax. All right, for the left side, and looking at the short end of the movement arm, my client is at 34 degrees. Okay, moving on to the right side, I'm going to have him hug his left knee, doing the same thing, palpating the ASIS and moving his leg to the first point of resistance. Good. Right there, making sure that his low back doesn't begin to arch. Okay, go ahead and hold that position. We'll quickly get him measured down the midline of the femur. Okay, and go ahead and relax. On the right side, my client is at 20 degrees of hip extension. On the optimal range of motion is at -5.